Hi, I'm Lebo Tshangela, and this is the 6th edition of the series Frontline Workers, where we talk to courageous essential workers who daily risk their lives to provide important services to the general public. Since the South African government eased the lockdown effected on March 27 from level 5 to level 4 on May 1, more businesses have opened outside of those that provided essential services. The decision was partly informed by the need to open up the extremely strained economy while introducing regulations that will enforce compliance with the government's aim to curb the spread of COVID-19. Pharmacies, banks, supermarkets, petrol stations, and healthcare providers are among those allowed to operate. Coming up in this edition of Frontline Workers.
I always have this fear like, what if, on my way to work, there's someone I meet and I can get it from the taxis. I want to still keep my job, but also I don't want to get this thing that's killing a lot of people. My mom is always asking me, do you have gloves on? Do you have masks on?
A cashier from Cape Town who has chosen to remain anonymous tells me what she goes through as a frontline worker. As part of regulations, supermarkets have placed a limit to the number of people who can go into a store at any given time and shortened their trading hours in order to allow their employees to travel from home before curfew. Anonymous says they are seeing a drop in the number of shoppers.
There's been a big difference since the whole pandemic started. We don't really see people a lot in the shop. Maybe around this time, around 12, it gets busy because, those who like the security guards and those who have the opportunity to be at work at this time, they come to shop around this time because it's lunchtime. But, our usual customers sometimes would get children who would come there, but now we don't see them anymore. And so, the number has decreased. And with the limits of people that are allowed in, it makes it even more low. So, the number has decreased.
In addition to shorter operating hours, other conditions for retail shops include ensuring that customers keep a distance of at least 1 square meter from each other, and that directions related to hygienic conditions and the exposure of persons to COVID-19 are adhered to.
We have 2 people standing at the door. There's one who sanitizes everyone's hands while they go in, and there's one who sanitizes the baskets that people come in with. And outside the shop, if someone wants to come in with a trolley, there are people outside who sanitize the trolleys. And when you come in, every single employee has got a mask on. And when you stand on the line for to come to the tills, we have like a 10-meter distance. So like the social distancing and the distance of 10 meters is respected. And when you get to the tills, we have all the cashiers have a mask on and the face helmets. So every cashier has both masks on, and we sanitize our tills often. I can say in a day, we work for 8 hours, so I can say it's sanitized after every hour or after every customer comes. So that's it. And if, for instance, the customer doesn't want to be sanitized while entering, we give them plastic gloves when they enter the store. So and sometimes if the customer feels their items are being touched by the cashier and they need it to be sanitized, we sanitize it there for them.
Over the weekend, an employee at a Checkers store in Sunningdale in Cape Town said the store continued to operate as normal, despite having a staff member who tested positive for COVID-19. This comes days after the Shoprite Group recorded positive cases in 17 of its Western Cape stores. The province currently has the highest number of infections in the country, with over 5,621 cases and over 106 deaths. The store in which Anonymous works seems to be complying with the level 4 lockdown guidelines.
I think we are curbing the spread of this virus. For instance, the store has been separated into 2 parts. We have, I'm off today, the other team is working today, and when I get to work, the other team is off. Just in case one person gets the virus, the other team can stay at home instead of having the whole store closed, and instead of having everyone, if instead of risking everyone. So yeah, I think these measures that we are taking are effective. For instance, the helmets that, like I said, we wear masks, face masks, and the face helmets. So it's like a double protection, if that's, yeah. So and those helmets, we sanitize them before putting them on. And we have gloves too. We put on gloves and we sanitize our hands after every minute. These measures are effective. For instance, if a customer had to come in and they didn't know they had the virus, when they come in, they sanitize their hands. They get to the till point. When they're done, they sanitize their hands. So I feel like it is effective.
As COVID-19 cases continue to rise, South Africa's infections sit at 10,652, with 206 deaths reported. That number globally is 4,118,783. New age technology has made our planet a lot smaller and more accessible. Travel, trade relations, and other interactions have been a lot more easier between people of different countries in the past decade. But in just a few months, the novel coronavirus has reinforced the borders significantly. This becoming the new and eternal normal is not what Anonymous fears the most.
I think it's everyone's fear, getting the virus. Like, what scares me the most is waking up this, because when we have to, I live a bit far from work, so I have to get a taxi, two taxis before I can get to work. So I always have this fear, like, what if on my way to work there's someone I meet and I can get it from the taxis, at the station. I always have this thing, like, what if I'm trying to help a customer and I didn't realize that my glass maybe is broken and they have it, or someone coughs and I wasn't wearing my mask properly, and it gets me. I don't want it to affect me in any way. I want to still be working. I want to still keep my job, but also I don't want to get this thing that's killing a lot of people. So yeah, I feel like that's everyone's fear. And also it not coming to an end, because everyone's life is affected. I had so many plans. I'm sure everyone had so many plans, but now because of this, we have to put them on hold. And I just fear it not coming to an end and it messing up our lives completely. Yesterday there was a customer who said, these masks are really uncomfortable, and I said, yeah, it's quite uncomfortable. And with the rate we're going, we might not be able to breathe properly without the masks, because we're gonna get so used to wearing them that it will become, we have to have it to like breathe properly. So my biggest fear, despite me getting the disease, the virus, my biggest fear is it not coming to an end and this being our normal life. That's my biggest fear.
Under Level 4 lockdown regulations, minibus taxis are restricted to a 70% loading capacity, and owners must provide adequate sanitizers or other hygiene dispensers for passengers. Anonymous says these measures make her feel safe.
I felt very safe. Usually taxis would be crowded with people and we are all squashed in it. But ever since this pandemic started, a taxi has about 7 to 5 people in it, or even 3. And that for me is safe because we are keeping our distances. And in the taxi, people are wearing their masks. Before you enter, your hands are sanitized. When you give the money, you sanitize your hand. I feel safe because I'm not squashed. I don't have someone breathing on my neck, and yeah, I feel safe.
As with other essential workers, the journey to and from work and her constant exposure to others is of concern to Anonymous and her loved ones.
My closest friend was even telling me that I should leave the job, and take care of myself and stay at home. But the truth is, I need the job. I need the job. And if I stay at home, or if all essential workers decide, well, we want to take care of ourselves, also we want to stay at home, who is going to be there to sell out food for people, who is going to be there to take care of the sick patients? So yes, they are very concerned, and most of them have really tried telling me to stay back and just stay at home. But I mean, there's always gonna be that one person that has to save the world. So if that's the position I have to take, then I don't see it being a problem. As long as I have a mask on and I've got gloves and I sanitize myself here and back and forth, I'm safe. So yeah, they are not sure, and about me leaving the house all the time, and with the number increasing every day. My mom is always asking me, do you have gloves on? Do you have masks on? And
Police have arrested scores of people for violating lockdown regulations. In the most recent incident, 2 were nabbed, 9 others fined, on the N14 highway which borders Gauteng and Northwest Province. This was for various infringements under the Level 4 lockdown rules. Anonymous says the people in her area are abiding.
people here are really, I'm not going to say afraid. They are respecting the rules, the regulations that have been put. Ever since this whole thing, everyone is in their houses. The only people I've seen outside are security guards, police, nurses. Those are the only people I see outside, or maybe a few who go and get important stuff in shops. But it's not like it used to be, where you'll see people walking around or people standing outside. The parks are empty. Everyone is respecting the regulations here.
Level 4 lockdown, which kicked in on the 1st of May, allowed more sectors to return to work. Banks and restaurants who deliver food are allowed to open for certain periods. People also allowed to shop with some limitations. There's generally more movement compared to Level 5.
If I had to compare, there's a huge difference. Firstly, our timetable has changed. I used to work from 9 to 5. Well, that was on Level 5. Now that we're on Level 4, we're working from 7 a.m. until 6 p.m. So that for me is like a drastic change. Like, I got used to waking up a bit late and leaving work a bit early, but now I'm kind of getting home late. So yeah, and everyone was at home. People didn't really come to shop that much. But now with since it's Level 4 now, people are coming out often. But now the thing is, when it was Level 5 and there was fewer people, we would allow them in without masks. But now no one is allowed in the store without a mask, and that kind of causes traffic at the door, because some people come knowingly that they know that they're not supposed to leave the house without masks, but they still come out without the mask. So it causes kind of like a confusion there by the door. But yeah, there's a change. There's a lot of people now, not as it used to be, as normal, but things are slightly getting back to normal. I'm seeing the faces I used to see. The closed restaurants that are kind of doing takeaways are now open, so I get to see those employees. They became family. So now, when this whole thing started, when we were in Level 5, since everything was closed down, we didn't see them anymore. But with the Level 4 and things slightly going back to normal, I get to see those people, and yeah.
Labour Minister Thula Nxesi says he's received numerous complaints from workers claiming that their employers are forcing them to work without the necessary personal protective equipment. Labour inspectors have been deployed to follow up. I asked Anonymous whether the delivery employees are provided with the necessary equipment.
I've seen a few with masks on. I don't know about gloves. And I think they have sanitizers with. I'm really not sure, but I have seen quite a few with masks on. Yes, they are adhering to the law. Yeah, because I've seen them with masks, so yes.
A survey conducted by Statistics South Africa has revealed that 42.2% of the country's businesses have indicated that they have run out of financial resources to continue operating during the COVID-19 outbreak. Retail giant Edcon, which owns Edgar's, Boardman, CNA and Jed, has informed its creditors and suppliers that it will commence voluntary business rescue proceedings as a result of the company's dire financial position. Edcon's already precarious financial situations worsened where the coronavirus lockdown was implemented. Anonymous says while she believes in her company's strategy, she still worries that an infection at the store could mean unemployment for her.
Like I said, we were separated into two teams. So currently, since I'm off, the other team is working. And tomorrow, our team is going to be at work and the other one is going to stay at home. That's how they've separated us, just in case one person from one team gets the virus, it doesn't affect the whole store. So yeah, we've been separated into those teams. Well, looking at how the strategy they've used, I don't think our store is going to close. I think this was a very good strategy. If it had to close, yes, I would lose my job immediately because it's only been three months. I've only been working for 3 months. I just started, so I'm not permanent as yet. If the shop closed down, I would lose my job.
For the next edition of Frontline Workers, you can visit sabcnews.com or at SABC News on Twitter, Facebook and YouTube. For SABC Digital News, I'm Lebo Tshangela.